Chiropractic and spinal manipulation should be primary in tackling the opioid epidemic. Chiropractors are trained specifically in ailments of the spine and extremities. The opioid epidemic is a tragic tale that chiropractic medicine can have a huge impact on. In 2017 and 2018, we had a 13% decrease. We were winning the war on opioids and reducing the number of deaths. However, in 2021, there were nearly 100,000 drug overdose deaths in the United States. This is over a 30% increase from the year before. During the pandemic, all the gains on the war on opioids have been wiped out, and we are seeing an increase in the opioid realm that starts with prescribed medication from medical physicians, typically for pain. In a study published in the Medical Care Journal in December of 2021, named Increased Utilization of Spinal Manipulation by Chiropractors to Tackle the Opioid Epidemic, spinal manipulation improvement was shown to decrease pain and increase function. Chiropractic care combined with primary medical care cut in half the use of prescription medicine when compared to primary care alone. This is due to not only pain reduction and increased function, but chiropractors notoriously educate their patients, which empowers self-care, which does not include going to the pharmacy to fulfill a prescription medication. The study showed a 64% lower odds of being treated for opioids when given spinal care than patients not seen by a chiropractor. A study released in 2022 named Efficiency of Primary Spine Care as Compared to Conventional Primary Care, a retrospective observational study at an academic medical center, compares the primary spine care model to traditional medical care. Lower back and neck pain is the largest expenditure in the U.S., estimated at over $140 billion a year, with increased expenditures for spine care interventions that have not correlated with improved results, such as spinal fusions, epidural steroid injections, and laminectomies. Back pain is one of the most common conditions that opioids are prescribed for. Outcomes of the 2022 study of 2,700 patients over 3 years showed the frequency of patients who filled a prescription for opioids 6 months post-discharge were significantly higher if the patient had started with a primary medical care physician. They had more hospitalization, they had more surgery, and they had more referrals to a specialist as opposed to this primary spinal care physician. If the patient started care with the primary spinal physician first, the outcome was dramatic. The results? 53% less likely to be hospitalized, 57% less likely to fill a prescription for an opioid, and 44% less likely to obtain spinal injections. Cutting the hospitalization rate in half, cutting prescription for opioids by nearly 60% is life-changing, not only for the patient, but the family that the opioid use would impact. This is not just a 3% impact, which would be valuable in itself, but a 57% impact, more than half. Most patients with back pain are first seen by a primary care physician. My appeal is that the chiropractic, chronic and acute pain should first be assessed by a primary chiropractic spinal care physician. 30 to 50% of the population is now dealing with chronic pain. A primary spine care physician would start with non-pharmacological care and coordinate the spine care of patients from initial presentation to discharge. If you have acute or chronic pain, please consider seeking a chiropractic first before filling a prescription for a pain medication. Yours in health, I'm Dr. Kim Carlucci.